Hi, my name's Gabriel. I'm going to be your nurse today, and I'm going to perform, or I'm going to initiate an IV. Can you tell me your name and date of birth? Okay, perfect. And do you have any allergies that you know of?
No.
Okay. And I'm also going to check the system to see if they have any allergies. And now I'm going to check the bag to check the order, and also check to see compare the EMAR and the MAR. And then I'm going to check it to see if there's any leakage, the coloring, and the expiration date. Okay, and now I'm going to check the tubing. I'm going to first start by clamping the tubing, roll that down, and then also clamp here. Okay, and now I'll start by flushing the J-tube. So first I have to clean the end of the J-tube, dispose of this, and I'll clean this. Okay, and then I would leave this to dry for 30 seconds, and then once that's done, I would take this cap off, and I would insert this in, and then I'll flush it, making sure that this is clamped as well. Flush. Oh, I have to unclamp. My bad. There we go. And then I would clamp it afterwards once the air bubbles are out. And now I'll get the bag and I'll take off this clamp or the cap, and I'll take this cap as well, and not touching any of the tubing. Okay, and then I'll use the push and twist method to insert this. Okay, and then I'll flip it over and I'll hang it up. And now I'll check to see if there's any air bubbles. So I'll unclamp this and then slowly roll this up to get any air bubbles out. And I'm supposed to fill this up halfway first. And then I'll roll this up. Okay, and once all of the air bubbles are out, then I'm ready to perform the actual IV. So first I am going to put on gloves, just clean gloves. And now I am going to put on the tourniquet tightly. Okay, and then I will clean the insertion site. Oh, and I would also put a pad underneath the arm before any insertion or cleaning. Dispose of this, and I would let this dry for 30 seconds. And then once that dries, then I would before that I would even feel for the vein for the insertion site as it at a downward stroke. And now I'm going to open up my needle once it dries, and I'm going to go in at a 10 to 15 degree angle with the bevel up, and I'm going to use my non-dominant hand to stabilize. And then I'm going to give the patient emotional support and say that they're going to feel a little poke. 1, 2, 3. And I'm going in until I see flashback. And now we got flashback. And now I'm going to slowly put it in a little bit further and put in the catheter. And now I can retract the needle, and I'm going to hold the insertion site and try and control the bleeding. And I would put the needle into the sharps container. And now I'd also take off the tourniquet. And now I'm going to get my my J tube and take off the cap. One moment. No, there we go. Okay. Now I'll insert. J-tube. Now I'm going to unclamp. See if I can get some drawback. And there is. So now I'm going to slowly push the saline in and see if there's any bulging. If there's any bulging, then I would have to reinsert the catheter. Okay, so now that we're good, I'm going to wipe down the site. Dispose of this, and now I'll clamp it for now and undo the syringe. And now I'm going to put the clear stabilizer over the top. And then I would label the sticker with the date, time, site, the size of the gauge, and also the type. And now I'm going to get my tube, open, take off the cap, and then I would use the antimicrobial to clean the end of the tube. And then I would insert the tube, and I'll unclamp this, and then I will slowly unclamp here to make sure that there is no bulging. Okay, and then also I would tape to further stabilize the insertion site. I would go tape over. And then I would use the pant leg method of the tape to go over the site. And then also under and over. And once I'm done with that, then I can lower the patient to their proper height, make sure that they're comfortable, and I would also, I would come back in 30 minutes to check on the insertion site, and I would take off my PPE and perform hand hygiene, and yeah, that's it.
Go.
Okay, so I will come in, perform hand hygiene, verify the patient's name and date of birth, and explain that I'm going to do a blood sample. And then also I would ask them which arm or area that they would like the blood sample to be coming from. And then first I'm going to do, I'll put on my gloves. And once my gloves are on, I will make a tourniquet. And I'm going to look for a good vein to go on here. And then once I find the vein, I will undo the tourniquet, make sure that the vein goes down, and then I will clean the site, going up and down, making sure I'm not blotting or just dabbing at the spot. Then while that's drying, I'm going to prepare my needle. So I'm going to first take off the bottom cap, screw it on, and then I'm going to just put this under, not all the way in, but just into it. And then while that's dry, I'm going to put my tourniquet back on. And then I'm going to take my cap off, putting the safety down. And now I'm going to explain to the patient that they are going to feel a poke. And I'm going in at a 10 to 15 degree angle with the bevel up.
Yeah.
Okay, now I'm stabilizing the vein. And as I'm going in and I feel the give, then I'm going to push the tube up. And I'm going to fill up the tube until the proper line. And once it's done, then I will get the gauze and put it over the needle site and apply some pressure and slowly pull the needle out. And then I will undo the tubing, and I would hold the gauze for 2 to 3 minutes and applying pressure. And I would put this into the proper sharps container. And I would also label this with my name, the insertion site, the patient's name, and the time that it was collected. Once that I'm done with the gauze, applying pressure, I would use an adhesive bandage to place over, and then after, once I get the flashback, then I can also take off the tourniquet, and once I put the adhesive bandage on, then I can lower the patient, put them into their proper place, and I would take off my PPE and perform hand hygiene and prepare to send the sample off to the lab.